Hey, my name is Larry Taylor. This is my assessment. Today, my patient is going to be Adam Johnson. And before I start the test, I'll let you know that I washed my hands before we started the exam, and all vital signs have been checked and everything has been found within normal limits. I'll try to read as loud as I can or try to talk as loud as I can because I'm doing this from my iPhone taped to the wall, basically. So, anyways. Everything good today, Mr. Johnson?
Yes, sir.
Good deal. Let's start out. I'm going to start out first assessing your skin. Skin is warm, pink, no obvious lesions, and no signs of dehydration at this time. You drink plenty of water?
Yes, sir.
Good deal. All right, fingernails. Fingernails are pink, clean. Capillary refill time is less than 3 seconds. Curved on the back, flat on the front, just like they should look. Good deal. All right, let's move up to your head. I'm gonna look at your skull and your face. Your face is symmetrical, no obvious signs of drooping or any abnormality seen at this time. Of course, your hair ain't much to look at. No lesions on your scalp. Everything feels symmetrical. All right, scalp looks good. All right. Check your frontal sinus. Any pressure?
No, sir.
Maxillary sinus, any pain or pressure?
Mm-mm.
All right. Let's check your TMJ, open your jaw. Close it. Any popping, pain?
No, sir.
One more time. All right, close it. Good deal. And I'm going to go ahead and feel for the temporal arteries at this time since I'm on his head. Pulse is regular and bilateral on both sides. All right, next up, I think we're gonna go ahead and jump to your eyeballs. You wear any kind of glasses, any kind of contact lenses, any problems with your eyes I should know about?
No, sir.
No, sir. All right. At this time, I'm just gonna look at your eyes. Close your eyes for me. No problems with your eyelids or eyelashes. All right, open them. If you will, pull your eyelids up and look down. All right, now pull them down and look up for me. All right, no obvious abnormalities seen at this time, so I'm going to go ahead and do some tests on your eyes. The first one I'm going to do is a corneal light reflex. I'm just going to shine this light, if it works, in between your eyes. Look straight at me. And what I'm looking for is to see the reflection in both pupils, and reflection is present in bilateral pupils. So that's a good thing. Next up, we're going to do pupillary response. If you would, cover up, separate your eyes. What I'm looking for is I'm going to shine this light into each pupil. I'm looking for direct constriction on one side, and when I do it on this side, I'm also looking for indirect constriction on this side. So we're going to do the right side first. With this light that ain't working. There we go. Positive for constriction. Let's check the left. All right, good job. Let's check the left. Direct is positive. Indirect on the right side is positive. I'd also like to say I'd have the patient do a Snellen test. I do not have a Snellen test, but I'd have him read a chart from 20 feet back, covering up his left eye first, then covering up his right eye second, then doing both eyes open. Since he doesn't wear any glasses or any contacts, we're going to assume that the patient's visual acuity is 20/20 at this time. All right, going to move on. Third test. Confrontation. What I want you to do is I want you to look straight ahead, and this is going to check your peripheral vision. I'm going to wiggle my fingers coming up from the side of you, and I want you to tell me whenever you see them, okay?
All right.
Look straight ahead for me.
Yes, sir. Wiggling.
All right, let's try this side.
Yep.
All right,
Yes.
good job. All right, next up we're going to do the 6 cardinal positions. I want you to look at my finger, and I'm going to move it to 6 different places. I want you to follow it, okay? All right, good job. Next thing we're going to do is accommodation. That's what I want you to do. I want you to stick your finger out in front of you, arm's length, just like this, and look at it. I want you to keep your eyes on your finger, and I want you to move it to your nose. All right. both eyes cross and they do accommodate. So this time we can say the pupils are equal, round, reactive to light, and accommodation. One last test I want to do is I want you to cover up both eyes while keeping your eyes open. When I tap you on the shoulder, I want you to uncover the right side. Uncover. All right, cover back up. One more time. All right, let's try the left side. Good job. One more time. All right, no abnormalities there. Last thing we're going to do is we're going to check my handy dandy ophthalmoscope here, and we're going to check your red reflex. We'll turn this light off so I can see a little better. Yeah, I can still see us. All right.
We look spooky.
I know it does look spooky. But straight ahead. The patient is positive for red reflex. All right. Same thing. We're going to swap hands here. Look straight ahead. Positive for red reflex. Checking your cornea and your sclera. All right. Good job. All right. That concludes our eyes. So this time I can say that cranial nerves 2, 3, 4, and 6, that's the optic, ocular motor, trochlear, and the abducens are all in working order and everything's intact. So next we're going to move on to your ears. You have any problems with your ears I need to know about?
No, sir.
No problems hearing? Only no selective hearing like all men have?
I got that.
Okay. Let's check your ears. You don't fall asleep on me. No problems, no pain?
No, sir.
All right. We're going to look inside. If you would turn your head for me that way. We're going to pull the earlobe up and back at 10 o'clock. Point forward. And if that gets too strong, let me know.
All right.
A little bit of earwax. No redness, no swelling. Tympanic membrane is a pearly gray color. Let's check the other side. If you would, turn your head. There you go. I'm going to grab it up 2 o'clock this time. Pull it up and back. Just in. Same thing. No redness, no swelling. Tympanic membrane is a pretty gray color. Alright, this time we're going to do a whisper test. I'm going to step to the side of you. And I'm just going to say a 1-2 syllable word. About 2 feet away from you. And if you would, I just want you to repeat it back to me, okay?
All right.
Alright, go straight ahead.
Baseball. Baseball.
Correct. I'm going to step over here and try that again. Softball.
Softball.
Softball. That is correct. This time is where I would check cranial nerve number 8, vestibular cochlear nerve. I would be using a tuning fork, which I do not have. So today I'm just gonna, we're gonna use a tuning butter knife here just to add. I do a Weber and Rene test. The Weber test, obviously I'd vibrate it, put it on his skull. He would tell me if he heard the sound louder in one ear versus the other ear or equal in both sides. Equal in both sides is what we want. And then the second one, the Rene test, we bounce it and we put it on his mastoid process behind the ear. Once he doesn't hear it there, I'd move it to his ear. And what we'd want there is we would want to hear air conduction is greater than bone conduction. And if that's the case, then the patient will have no problems with hearing and letting us know that cranial nerve number 8, vestibular cochlear nerve, is intact and working. All right, this time we're going to move on to your nose. Any problems with your nose?
No, sir.
Never had a broken nose, nothing like that?
No, sir.
All right. If you would, look back for me, or look up. I'm going to look inside each of your nostrils. May tickle a little bit. If you sneeze, please let me know. All right. No signs of a deviated septum. No signs of polyps. Mucosa is pink. Looks good. This time we're going to check cranial nerve number 1, which is your olfactory nerve. I'm going to have you close your eyes. Close your eyes for me. I want you to cover up your left nostril. How's this side? There you go. I want you to take a smell in your right nostril. Tell me what you smell.
Coffee.
Coffee. Good job. All right, same thing. Close your eyes. Cover up your right side of your nostril. Take a breath. Tell me what you smell.
Vinegar.
Vinegar. Good deal. So at this time, we will say that the patient's olfactory nerve is intact and in working order. All right, so we're going to move along to the mouth. Any problems with your mouth I need to know about?
No, sir.
No sore throat, nothing like that? Go to the dentist often?
Mm-hmm.
On a regular basis, at least? All right, if you would, open your mouth for me. Look up a little bit. Let me have you take your pinky and pull out your left cheek. All right, good job. Do the right side for me now. All right, good job. I want you to take and roll up your top lip. Good job, and do the same with your bottom. All right, now, this time I don't see any obvious defects. Teeth all look to be in good order. Pink mucosa, no swelling, no redness, no bleeding. So this time I'm going to check 3 more cranial nerves. That's 9, 10, and 12. The glossopharyngeal, the vagus, and the hypoglossal. So for the first one, glossopharyngeal, we're going to check a gag reflex. So if you would, open your mouth for me. Okay, yeah, that is intact. All right, the vagus nerve, I want you to open your mouth for me. I want you to say ah.
Ah.
All right. The uvula does go up and it does come back down. It does not deviate left or right. Therefore, your vagus nerve is intact and in working order. Last one, I want you to stick out your tongue for me. Move it side to side. All right.
Which makes my eyes water.
And the hypoglossal nerve, number 12, is intact. All right. Next, we're going to do 2 more cranial nerves. We're going to work on your face here. The 2 on your face, we're going to do your trigeminal nerve and your facial nerve. Trigeminal, number 5, is checked by 2 parts, motor and sensor. For the motor, I want you to clench your teeth for me. And you see the masseter muscles tense up, loosen. One more time. Good job. All right, for the sensory part, we're going to use a toothpick I've got broken here as a soft side and a sharp side. I'm going to touch you in 3 different places: forehead, your cheek, and your jawline on both sides of your face. I want you to tell me, and I'll show you this one. That's soft, and that's sharp. So whenever you feel one, just tell me what you feel. Close your eyes.
Dough.
Good job.
Sharp.
Yep.
Dough.
Yep.
Sharp.
Yep.
Dough.
Yep.
Sharp.
Good job. Trigeminal nerve is intact. Next up, we're going to do your facial nerve. Facial nerve is broken up into 2 different parts, the upper and the lower. The upper, I want you to raise your eyebrows. Good job. And I want you to keep close your eyebrows, keep them closed despite resistance. There you go. All right, good job. Last one, I want you to show me your teeth. Good job. All right, so that means cranial nerves 5 and 7, trigeminal and facial, are intact and in working order. Cool beans, you okay so far?
Mm-hmm.
All right, good deal. Next up, I'm going to go to the neck. Any problems with your neck?
No, sir.
No problems? No stiffness? No soreness? You work out, right?
Mm-hmm.
I don't enjoy this massage too much. First up, I'm going to check his trachea. Trachea is midline, no deviation to left or right. I'm going to palpate your thyroid. All right, can you swallow for me? Good job. One more time. I got some vinegar over here.
I had to come with something to swallow.
All right, at this time, I'm gonna go through and I'm gonna check out all the patient's lymph nodes, starting with the preauricular, posterior auricular, tonsillar, look down for me a little bit, submandibular, and submental. Any soreness, any tenderness in here?
Feels good.
Anterior cervical. That's in front of the sternocleidomastoid muscle, whatever you say that. Posterior cervical. No tenderness. Supraclavicular. And the last one is the occipital. No tenderness anywhere. All right. While we're doing your neck, I'm going to go ahead and check range of motion. If you would, I want you to flex your neck, put your chin down to your chest. All right. Look up at the ceiling. All right. I want you to Do your lateral bends. I want you to touch ear to shoulder. Right side ear to shoulder. All right, I want you to rotate left, rotate right. Any problems?
No, sir.
No pain. All right, good. I'm gonna check the last cranial nerve, which is the accessory nerve number 11. I'm gonna do that first. I'm gonna place my hand on this side of your cheek, and I want you to turn against resistance. That's checking the sternocleidomastoid muscles. All right, go ahead. Good job. And this one. And the last one we're gonna do is the trapezius. I want you to shrug your shoulders against resistance. Good job. So this time we'll say that the patient's last one to test. This is the accessory nerve, and it is in functional words. That's all 12 cranial nerves I've tested this time just on the head. So we done your neck. So now we're gonna do your lungs. Any problems breathing? Any shortness of breath?
No, sir.
No problem. Let me have you remove your shirt at this time if you don't mind. I would give you one of them fancy gowns, but we don't have none. So I'm just gonna let you get all naked here in front of the camera.
We are in the bedroom.
We are in the bedroom. This will be on YouTube. So no problems with your chest.
No, sir.
No soreness, nothing nowhere. Alright, insect palpate. We're gonna go ahead and percuss it this time. Patient does have good hollow sound. And this time, I'm going to pause my video because I left my stethoscope outside in my trunk.
About to ask you.
Alright, sorry about that. Got the stethoscope at this time. Alright, we've inspected the lungs, we've palpated the interior lungs, we've percussed them, and we're going to auscultate. Deep breath in and out for me. Alright, good job. Any problems?
No, sir.
All right, I'm gonna check tactile firmness. I'm gonna have the patient say 99 using the side of my hands. The main thing is that I don't, not that I do or don't feel vibration, but is that I feel it equally on both sides. 99.
99. 99. 99.
And you do feel hollowness in there. You feel it vibrating, and it is equal on both sides. All right, this time let me have you flip around on this so-called examination table. That's good right there. In fact, slide back to me a little bit. Alright, and you want to aim to the... Yeah! Alright. Any problems with the back side? You said no? No problems breathing, no tenderness anywhere.
No, sir.
Alright, inspect, palpate, let's percuss. Patient is hollow sounding, which is good. Last up, I'm going to auscultate the anterior lungs, including the lateral lungs, too. You're good, just keep sitting. Deep breath in and out. All right. Alright. Lungs are clear to auscultation, no signs of adventitious breath sounds, no wheezing, nothing like that, all clear. I'm going to do tactile firmness one more time. Make you say 99.
99.
Yeah.
99.
Again.
99.
And again, bilateral vibrations on both sides. Let's see. There's a couple more, one more test on, let's see. I know I'm going to do this. We're going to check for lung expansion. I'm going to place both of my thumbs on each side of his spine. Ask him to take a deep breath. And we'll close it back in. Alright, deep breath. Let it out. One more time. There you go. Alright. The last thing I want to notice is the anterior posterior diameter is smaller than that of the transverse diameter. Basically, that's saying that from the xiphoid process to the vertebrae is approximately half the diameter just from going side to side, which is true in this patient. Therefore, we can say the patient has no barrel-like chest or no kind of concave chest. It is normal this time. So we're going to say lungs are all good. All right, if you would, turn around for me. Feet hanging off this end down yonder. Oh. And then I'm going to have you lay back on this here table for me. This flat, hard table, so get comfortable. At this time, well, good the camera can see, but this time we're going to start doing the heart. I'm going to start off by palpating for any kind of thrills. Yeah, feel the thrill. Any kind of thrills or any kind of pulses. I'm going to start in the second intercostal space on the right side, which is the aortic. Then I'm going to go over to the left side, which is pulmonic. Move down to the tricuspid. Then I'm going to come over to the mitral, which is around the fifth intercostal space in the mid-clavicular line, and which is also the apex of the heart and the point of maximal impulse. No pulses felt, no thrills, no abnormalities, no kind of tenderness. You know, you're not on any kind of heart medication, nothing like that, are you?
No, sir.
All right. And this time I'm going to auscultate first. I'm going to diaphragm, listen for any bruits or anything. Then I'm going to flip it over and listen with my bell and assess for any kind of heart murmurs. The sounds of bruits. I'm going to swap over to my bell. See if we hear any kind of murmurs or such. Patient does have a healthy lub-dub sound. I don't hear any abnormalities, so this time we're going to assume all is well with that. While I've got him lay here, we're going to go ahead and start assessing the central cardiovascular, consisting of the aorta going down the midline. I'm going to listen to the renal arteries halfway between the nipple line and the umbilical, and also the iliac arteries, which are just slightly below the umbilical, branching left and right. So I'm going to go ahead and listen to them. Same thing, I'm going to listen to see if there's any sort of bruits. Iliac arteries. No sounds of bruit in those, so I'm going to continue. I've already assessed his temporal arteries, so I'm going to go ahead with the carotids. First thing I'm going to do is to hold his breath, and I'm going to auscultate left and right, and then I'm going to palpate left and right. So if you would, deep breath. I'm going to check your left side first. All right, deep breath and hold it. All right. All right, exhale. Deep breath and hold it. All right. No bruits of any sorts. I'm gonna palpate. Patient has a regular pulse. Present bilaterally, it's not bounding. Good healthy heart rate. Alright, since we've assessed all the central cardiovascular, I'm going to move to the peripheral, starting with the arms, and then we'll move down to the legs. So let's see. First up, we're going to do brachial pulse, which is good and strong. Radial pulse on the inside of the wrist, on the side of the thumb. And ulnar pulse, it's on the outside of the hand, close to the middle. Positive. Alright, I'm going to come over to this side and do the same thing. Hopefully the camera can still see me. Alright, we're going to do brachial, present, radial, present, and ulnar. Also present. Alright. If you could, I'm going to have you bend your knee, put your feet up on the table for me. There you go. This time I'm going to check his lower peripheral, going with the femoral, popliteal, the posterior tibial, and then we'll check the what's called dorsalis pedis pulse. I'm going to dig in a little deep there. Positive. I'm going to block the camera. I'm going for the popliteal behind the leg. Just straighten the leg out for me just a little bit. There you go. Alright, relax, just lay it flat. Assess the femoral. Popliteal. Alright, lay your leg up for me. Going to the inside of the foot if you can't see that. I'll show you. There we go. Alright, lay it back down. Posterior tibial. Alright. Posterior tibial on the right. Present, very good, strong pulse in both of them. Let's check the dorsalis pedis on both of them. Alright, positive in both of them. You okay, Leonard?
Oh yeah.
Alright, so we're going to say the heart cardiovascular system is all good at this time, so we're going to move on to the abdomen. Inspecting, no signs of pulsations, no signs of abnormalities. So I'm going to go ahead and auscultate it this time, starting in the right lower, right upper, left upper, then left lower. You just ate anything? Patient has hyperactive bowel sounds. They're having a party in there apparently. Alright. Positive bowel sounds in all four quadrants. This time I'm going to percuss all four quadrants. Hear that? That sounds pretty cool. We're listening for tympany, which me and the patient can both hear. Alright, so good with that. And the last thing I want to do is palpate. In each quadrant, I'm going to do light palpation, and I'm going to do deep palpation. So I'm going to go just kind of easy, and I'm going to go a little harder. Any pain? Nothing abnormal. Alright.
Open that party.
Yeah, don't let me push nothing out. Alright. Nothing? Still good. No abnormalities felt. Alright, so no problems there. Alright, we're going to move on to the liver. I'm going to try to identify the liver span. Basically, I'm going to percuss starting from down going up, then I'm going to percuss starting from the ribs going down. right in there. And come down. Alright, so what I'm going to do next is we're going to palpate the liver. I'm going to place one hand at his back, the other on top below his rib cage, have him take in a deep breath, then we'll have him exhale, and the liver should go below my fingertips. Alright, deep breath. Alright. One more time. Alright. Do that. Gonna go opposite side. We're gonna do the same thing for the spleen. If nothing is out of whack, I should not be able to feel the spleen. All right, deep breath. All right, let it out. And I don't. And I'm gonna go ahead and try to palpate the kidneys. Any pain? Any pain? Pressure? Alright, let me have you sit up. Yeah. Alright, let me swing you around so your back's facing the camera. One last thing on the abdomen we're going to check is the costovertebral angle. It's where the last of the rib comes up and meets the spine. And what we're going to do is we're just going to... Any pain?
No, sir.
Same thing.
You jiggling?
I'm good. You good? Any pain may indicate a kidney infection, pyelonephritis, anything of the sort. So, all that done, we're going to have you turn around and face me this way. And what we're going to do is we're going to start working through the joints and the muscles. So, I want you to show me your fingers. Start your fingers. Going to work the way up the arms. Come back down to the legs. I want you to extend them, flex your fingers. Make a fist. Extend them. Abduct, spreading them. And then close them back. Good job. Thumb, I want you to just kind of move it all around. Any pain?
Yes, sir.
All right, we're going to do your wrist. I want you to flex, extend. All right, hold them flat. I want you to move them in and out. Any pain?
No, sir.
All right, going to move up to the elbow. I want you to flex, extend. And then I want you to hold them flat. I want you to kind of rotate. Feel it at the elbow. Any problems?
No, sir.
All right. Next up, we're going to move up to the shoulder. The shoulder we're wanting to follow for 3 different points. One is the acromioclavicular notch. That's where the acromion process and the clavicle meet. Any pain?
No, sir.
The greater tubercle of the humerus. Any pain? Problem?
Mm-hmm.
Let me go on this side and do it. Any problem?
No, sir.
Shoulder?
Mm-hmm.
And the last one we want to check is the coracoid process, where it comes down and meets the scapula right here. Any problems?
No, sir.
All right, I'm going to check your shoulders while I'm standing behind you. I want you to extend your arms, watch your cables up above your head. Extend your shoulders straight above your head. All right, I want you to flex. I want you to put it down and bring them behind you. There you go. And, straight out. Reach straight out behind you. There you go. All right. Any problems?
No, sir.
That boy right here, muscular. All right. I want you to abduct your arms, put them straight out. Good deal. Now adduct, put them straight down. And the last thing we're going to do is external and internal. I want you to take your right, and I want you to reach over your head and touch the base of your neck. All right. Now I want you to relax. Now I want you to put it behind you and reach up here to your scapula. Any problems?
No, sir.
All right. Same thing. Let's try the left, base of the neck. All right. Relax. And now opposite scapula. Any problems?
No, sir.
No pain. Good deal. Good deal, good deal, good deal. All right, turn around and lay down flat for me on the table.
Face that?
Bow your way where a while, go side up as much as you can. We're going to do your hips.
Back.
We're going to do the hips, the knees, and the ankles. All right, so hip. First thing, we're going to flex. I'm just going to lift it straight up. Don't fight me. Any pain?
No, sir.
No pain. Flex this one. Any pain?
No, sir.
All right, I want you to roll over on your belly, and I want you to push them up behind you. Kick them. Basically doing kick straight up. We're going to extend them. Any problem, either one of them?
No, sir.
Mr. Show Off here is going to do them both at the same time. All right, good job. Roll back over on your back. All right. All right, relax for me. Well, first, let's abduct. I'm going to pull away from your hip, okay?
Okay.
Any pain?
No, sir.
Relax your legs, man. Relax. I got your weight. Relax.
I'm sorry.
Okay. and over. Any pain?
No, sir.
Alright, same thing. In, any pain?
No, sir.
Out?
Nope.
Okay, alright. Let's bring it up to your chest here, and then we're gonna do internal and external rotation of the hip. Pain?
Mm-mm.
In?
Mm-mm.
Alright. Same thing. Internal, in,
No, sir.
external.
No, sir.
Alright, good job. Alright, I want you to sit up on the side of the table for me, facing me again. You're gonna be good and We're gonna do the knees next. No obvious signs, just by inspecting them. I don't want you to flex your knees backwards. Alright, other one. I want you to extend the right. Alright, extend the left. Any problems, any pain?
No, sir.
Internal, I want you to just let this part of your leg be still and relax. I'll move it for you. Any problem, pain?
No, sir.
Problem, pain, internal, external.
No, sir.
Alright, ankles. I want you to plantar flex, first point your feet down. Good job. Dorsal, plant them up. Good job. Now I want you to like roll your hips in, roll your heel inward, outward. Like you're gonna tweak your ankle. Any problems?
No, sir.
Alright, I don't know if the camera can see it now. I'm gonna check between all toes.
I cleaned them for you.
Good job. I appreciate that. I always enjoy the patients being clean. All right. Next up, I want you to stand up. I want you to face the camera for me. Feet together, stand. All right. Seems to be in a straight line from the hips, knees, ankle, feet, straight down. I'm going to put my hands on the hips, keep you from falling. I want you to bend to your right at the waist. All right. Stand up, bend to the left at the waist. Any problems?
No, sir.
All right. Bend forward, touch your toes. Alright, stand back up. Any problem?
No, sir.
Straight back, lean back to me. Alright, that's good enough. Spine stays midline, no problems. Anyway. Alright, try to get here where I can see everything. First up, let's take a look. So I think it should be good enough, maybe. Alright. Next we're gonna do the Romberg test. I want you to stand there. Alright, good. What I'm gonna have you do is I'm gonna have you close your eyes. I'm gonna count to 15, and I don't want to see you moving or floating around anywhere. But just stand there. You're doing good. 6. Alright, good job. Open your eyes. Next up, we're gonna do a pronator drift test. I want you to stand straight, same you're doing. I want you to hold your hands out like this, and I'm gonna have you close your eyes and count to 15 again. Alright, close your eyes. 1, 2, 5, 11. All right, good job. Patient does not deviate, so appears to be all good. All right, I want you to walk to me, just a normal gait. Walk to me, walk back.
Okay. I can see your back.
Sorry. Walk to me. Good job. Turn around, walk back to the end of the table. All right, good job. Now I want you to turn around and walk to me on your toes. Now turn around and walk back on your heels. Alright, now I want you to turn and walk back to me, heel to toe. And then you can just turn around and walk back regular. Alright, good job. Last thing I want you to do is, I can get there. I want you to point your finger to my finger and then to your nose. Keep doing it. Alright, that's good. Let's sit right here. Now I want you to do rapid alternating movement. I want you to take your hands, place them on your thighs just like you had them, and I just want you to flip them back and forth over. Good job. Alright. Next up, we're going to test muscle groups, motor function, I think that's right. Alright, I want you to grip my fingers after you touch your armpit. Grip them while I'm pulling. Ain't no way they coming loose. All right, good deal. We're gonna check your deltoids. Hold your hands straight up. I'm gonna push down. No problems. All right, relax. Just check your biceps. I'm gonna pull. You pull back to you. All right. Show off. Same thing. All right. Check your triceps. I'm gonna push. You push away from me. All right. All right. Let's see. Now we're going to check hip flexor muscles. I'm going to push down. I want you to push up against my hands on your knee. All right. Okay. Same thing. I'm gonna pull your ankle. I want you to flex away. Then I'm gonna push your lower leg, and I want you to stand out. Okay.
Gotcha.
So I'm gonna pull first. All right, left side. All right, now let's push. Okay. All right. Yeah. All right. That auto motor is working good. All right. Going through the reflexes. First, we're gonna start with your brachii or your biflex. Oh, shoot. Bicep. I'm gonna find that tendon. Let's see. There we go. Just relax. Hey, look at it jump. All right, I'm gonna go and check your tricep on this side. And you do see the tricep muscle tense up. Check the left side. What I'm doing is finding the tendon. I'm hitting my nail, and you can see his bicep muscle jump. Tricep. You can see it jump. And then we're going to do the brachioradialis. Have your hand, turn your hand on the side, come up a little ways from the thumb. For that tendon. There you go.
That's real funny.
Alright, left side. And you can see it flex. Alright, now we're going to start with your patellar. Then we're going to do your Achilles. Then we do your Babinski, or look for the Babinski. We're going to do your plantar reflex. Alright, let's start on the right side, patellar. Oh, sorry. Alright, relax for me. I'm going to pick your legs up here. Good job. Good job. Alright, relax. Alright, negative for any signs of Babinski reflex. Alright, plantar reflexes are good. Next thing we'll do is a few sensory tests. I'm going to get back out my sharp and dull pencil over here, and you remember dull side, sharp side. I'm going to have you close your eyes, and I'm going to check all four of your extremities, hands and legs. I'm also going to check around your chest area, and I'm going to check around your umbilical area. I want you to just tell me if it's dull or sharp, okay?
Sounds good.
Start with your hands.
Stop. Start dull. Sharp. Dull. Sharp. Sharp. Dull.
All right, under your feet for me.
Dull.
All right.
Sharp.
Good deal, good deal. All right, now we're going to do positional sense. And I'm going to take either your big toes or your fingers. I'm either going to move it up, I'll move it down. And just see what it feels like with your toe. This is up, and it's down. So close your eyes for me and tell me if it's up or down.
Up.
All right.
Down. Down. Up.
All right. One last test. Of course, I do not have my tuning fork, so I'd be using my butter knife. This is where I do vibratory sense. I'd hit my tuning fork, and I'd place it on the knuckle of your fingers and the knuckle on your joints of your toes. The patient would tell me whether or not he would feel vibration. We'd go through each one, and it'd either be simple yes or no. So, sorry I don't have that part. Sorry I forgot my stethoscope. But at this time, I'm thinking that's going to conclude this. So again, this is Larry Taylor doing my assessment.